Welcome back to Talk Pittsburgh. Thank you for spending your afternoon with us.
Ahead this half hour, just hearing the word outbreak can make people uneasy. But when should we actually be concerned? Find out how our health department tracks potential threats and responds when illnesses start to spread.
And new moms, if you're trying to make friends but having a hard time, this conversation might be the nudge you need to build your village. First, let's get into some good news that has us talking.
All right, and we are going to start with a local business helping out a local cat rescue. Nose to Tail Cat Rescue posted these pictures on Facebook saying Wade Heating and Cooling stepped in to help after almost a year without AC. Director of the rescue, Sandy Eaton, wrote that things were so uncertain and last summer was rough without air conditioning. And now she said it's a healthier environment for the cats and one less thing that's keeping her up at night. And just love to see one business helping out another.
That's really wonderful. And a local cyclist is about to embark on a journey across the country on a bike. He has 12 days to race from California to New Jersey, and while he's on the ride, he's racing for the Turkey Fund. Jeff Kuntz was on PTL earlier today, and we will be tracking his journey and let you know where he is.
Really excited to share that over the next couple of weeks. Remember when none of us had heard, or most of us had heard terms like community spread, contact tracing, or even coronavirus? Now it feels like there's always a new health headline making waves, from the hantavirus to Ebola, and even now the measles.
Yeah, and with major global events like the World Cup bringing huge crowds together, some people are wondering, how worried should we be? Dr. Jillian Irwin is back with us to help separate fact from fear and take us behind the scenes of what really happens when potential health threats emerge. So thank you for joining us again. Now, when people hear the word outbreak, what does that actually mean from a public health perspective?
So when we talk about outbreak, we are talking about cases of a disease that are linked both in time and in space, that are over and above the amount of cases that we would expect for a certain time period and geographic location.
So looking at those outbreak numbers, how do you determine, even at Allegheny County Health Department, when something is a serious threat to the community?
So it depends on a variety of factors. One is, what is the disease in question? And with the disease in question, what are the characteristics of that disease? So, with COVID, it was extremely contagious because, and easy to spread, because asymptomatic spread. People could get it, they would have respiratory droplets that would, stay in the air, and people wouldn't even know they were spreading it because they didn't feel sick yet.
And that was kind of like what we were seeing the difference with hantavirus, is that you can't spread it until you're symptomatic. Is that right?
It's contact spread.
It's contact spread. Mm-hmm. Okay.
Yeah. And so what have we learned post-COVID in terms of preventing and kind of minimizing and slowing the progression of these types of outbreaks?
So we've learned a lot of things since COVID. One is that trust from the public is of equal importance as the medicine itself, what we call our medical countermeasures. So we have really been working on building relationships with the community, also with emergency services from the health department, as members of the health department, in order to create those channels of communication. We've also, learned that there's no other way to do it besides to really communicate clearly.
Yeah. And we know that trust is a big thing. A couple weeks ago, we were talking about newborn screenings and people questioning even those at the hospital. And we know that vaccines have become a big question for some people. And with that, we've seen an uptick in even measles cases now because people are choosing not to get vaccinated against them. What are you guys doing at the Allegheny County Health Department to try and help with that trust and help spread the word about it?
So part of it is, like I said, going into communities, meeting with organizations, meeting people where they are, and learning what are the best ways to communicate with people, speak to them in the language that they speak, and making sure that they're vaccinated. So for vaccine-preventable diseases like measles, the best protection is vaccination. So we're working with community organizations to get out there and get people their immunizations.
And with the World Cup coming up soon here in several cities across the country, and closest to us in Philadelphia, are you concerned about the spread of these diseases?
So yes and no. The news is, yes, there are diseases in international place, there are diseases outside of the U.S. that are more prevalent than they are in the U.S. Vaccine preventable diseases. Do those pose a risk? Sure. And people are coming. However, our systems are so much stronger than they were before COVID. Our systems for detecting, for isolating, for communicating, and for treating. And I really think that it's not something that we need to be worried about over and above just the day-to-day.
Okay. Really interesting conversation. We want to thank you so much for joining us today and talking about this.
All right, well, still to come on Talk Pittsburgh, we're checking in with Barry Pintar in the newsroom for your first look at the KDKA Evening News.
Plus, creating community for moms. We are talking to the woman behind this local group. That's coming up next.